Hi, everyone. I'm Jane Hansen, here to say on behalf of the physicians and staff who work at Catholic Health, your health is our mission. Each week, we bring you lively, short stories about real people on Long Island who've been restored to wellness thanks to the expertise and commitment of the Catholic Health team of professionals. Today, we have an interesting story about a Massachusetts man who drove to Long Island for the care he needed to save his eye. Christopher Barrios was frustrated. He was having an issue with his eye, and at first, it didn't seem too serious, but it was impacting his job as a line utility worker in the Boston area. He sought treatment locally, was told it was a routine infection that would eventually improve. Unfortunately, it didn't, so Barrios asked family members for advice. His future mother-in-law, who lives on Long Island, recommended he speak with her physician, Dr. Andrew Ciancimino, a Catholic Health Physician Partners internist. By the time Barrios called Dr. Ciancimino, his eye infection was so bad that it had swollen shut. He sent a photo to Dr. Ciancimino, who didn't like what he saw. He recommended that Barrios immediately come to the emergency department at St. Francis Hospital in Roslyn. Since he couldn't even drive himself, Mr. Barrios' fiancée got behind the wheel. The two headed down to Long Island. Let's hear more now from Dr. Ciancimino himself.
Chris's mother-in-law had called me and actually was concerned for her son-in-law and sent me a picture of him. The eye was starting to swell a little bit. I was concerned that this patient's eye was going to get worse since he hadn't been treated yet, and it's a sensitive part of the body that is very difficult to replace, so we wanted to make sure that it was taken care of right away. It was pretty clear by the photo that it was probably something called a preseptal cellulitis, which is an inflammation of the tissues of the eyelids and around the orbit of the eye, not of the eye itself. If left untreated, however, it can lead to an orbital cellulitis or cellulitis of the eye, which is an ophthalmological emergency and a much bigger deal. He was concerned because he was starting to feel worse even on the drive down. So when I spoke with his mother-in-law, we made a decision to actually even skip the office and go straight to the ER. We're in the ED. We're gonna go ahead with IV antibiotics, appropriate IV antibiotics, broad spectrum antibiotics to treat this. And that's what was done appropriately. At that point, we started to have to ask some questions. And we found out that the local pond they were swimming in was having a blue-green algae bloom, colloquially known as blue-green algae, but otherwise known as cyanobacterium. And we started to think maybe this might be the cause, or maybe this might be adding to it. We had done a CT of the orbit. The eye thankfully wasn't affected. But we started doing our homework and started looking into things, and the way some of the skin was bubbling around the area, the way that you can get a conjunctivitis because of it. There are cyanotoxins that could potentially cause these symptoms, and so since he wasn't getting better with what we were doing, we decided to give this a try, and he got better, and everybody was just relieved. That was the bottom line. Well, no matter what you do, you have a human life in front of you, and so you have a responsibility to at least try your best to make an effort to find out what you can do to make this patient's life better. And if you don't know the answer, or you can't figure something out, ask for help. And we had all of that here. It was great teamwork, and we see this all the time throughout the system, throughout the hospitals. I'm just very fortunate to work with a great team every day here in the office and in the hospital. Everybody's caring, everybody wants patients to get better, and everybody likes to communicate, and that's what creates these good kind of outcomes.
We're so glad Barrios is feeling much better. His eyes are fine now, thanks to the expert treatment he received at Catholic Health. It just goes to show, if a health issue isn't going away, don't delay. Get help. Once again, for the doctors and nurses of Catholic Health, your health is our mission. If you need a physician or hospital service, Catholic Health can help. Call 866-MY-LI-DOC to speak to a physician referral specialist. I'll see you next time.